is Tiah Tomlin-Harris, Community Advisory Board member for the Bench to Community Initiative and CEO and co-founder of My Style Matters, Inc. Welcome to today's Salon Conversations, How to Perform a Breast Self-Exam. I am your host and moderator for today's discussion. Thank you so much for joining us. For those who may not know, Salon Conversations is a community forum where we bring awareness, educate, and provide actionable steps towards sustainable change about various topics related to breast health, reducing exposures to endocrine disrupting chemicals, and more. This forum is a part of the Bench to Community initiative led by Community Advisory Board members like myself, Bing Turner, Maggie Hawkins, Pastor Rhonda Holbert, Tanya Fairley, and Dr. Dede Tate, who's an assistant professor of public health at Chapman University. You can watch previous Salon Conversation episodes on YouTube at Bench to the number 2 Community. The Bench to Community initiative is a multidisciplinary collaboration between community stakeholders and scientists to better understand the relationship between harmful chemical exposures from personal care products and breast cancer risk. For more information about the Bench to Community initiative, visit benchtocommunity.org. That's bench number 2 community.org, and follow our journey on social media at Bench to Community, Bench number 2 Community. Before we get started, please note, all participants will be in listen mode only, and we ask that you keep your microphones muted throughout the presentation. You will have a chance to ask questions during the live Q&A portion. If you have any questions throughout the presentation, please add them to the chat. You do not have to wait until the end of the presentation to send in your questions. Our chat moderator, Dr. Jasmine Tapia, will be keeping an eye on the chat throughout the presentation. To submit a question, click on the chat bubble icon, type in your question, and then submit your question by clicking the blue icon with the arrow. It is my pleasure to introduce our speaker for today's discussion, physician assistant Rhonwynn Dozier. Rhonwynn, or Ronnie as she calls herself, has practiced healthcare for 23 years in various capacities, both as a registered nurse and physician assistant. She has several years of experience in oncology in the setting of breast surgical oncology, hematology, and medical oncology. She excels at collaborating with clinicians to proactively identify ways to streamline processes to help optimize patient care and clinical outcomes. Ronnie, or Rhonwynn, also enjoys conveying complex concepts to patients which helps them to better understand their disease state and treatment options. Her true passion is educating and working with women and men who have been diagnosed with breast cancer. Welcome, Ronnie. I am so excited for today's conversation, and I just want to say it is BCAM month. So this is a great topic. BCAM, for those who don't know, is Breast Cancer Awareness Month, but we take it a step further and we call it Breast Cancer Awareness and Take Action Month. So thank you so much, Ronnie, for joining us. I'll turn it over.
You're so welcome. So welcome, Tia. So good evening, everyone. What a warm welcome, and I'm glad to be here with you guys this evening. And I hope that today's presentation will, hopefully you'll learn something that maybe you didn't know, or maybe as far as, you can elaborate or ask questions at the end, as Tia so pointed out in the Q&A session. So let me share my screen here so we can get started. And as she said, please feel free to, put your questions in as we go. Don't wait, because I know I'm one that I can't wait. So hopefully everyone here can see my slides. So as Tia already pointed out, today's presentation is going to be about how to perform a breast self-exam. And so tonight's objectives, what we plan to do is we hope to help you to recognize the significance of regular breast self-exams in early detection, to also recognize proper techniques used to perform a breast self-exam, recognize how to detect signs and symptoms, which are abnormalities, and also to discuss the changes with the breast during the menstrual cycle. So what is a breast self-exam? pretty explanatory, I would say. But I would just say it's a technique which uses visual and physical examinations to examine your breast to detect any changes with the breast. Now, I know we're concentrating more so on breast self-exam, but I wanted to also put a plug in for a term that you may have heard that's called clinical breast exams. And I don't have it on here, but I just wanted to mention it. A clinical breast exam is an examination of your breast that's performed by a clinician, whether that be a nurse practitioner, a physician assistant, or your physician. And generally that occurs on a yearly basis with your physical exams, generally starting at the age of 40. So I wanted to put a plug in for the clinical breast exams as well. So the question becomes, how often and when should you perform a breast self-exam? So breast self-exam should be performed on a monthly basis, once a month. And how do you pick that day? So it differs between if you're postmenopausal or if you're premenopausal. So it's pretty easy if you're postmenopausal. You just pick a day of the month and you kind of put that on your calendar, and that becomes your day of the month, every month that you examine your breast. So say if you pick the 15th, we'll know that on the 15th of every month, like clockwork, that's when you should perform your breast exams. Versus if you're premenopausal, you should at least wait 5 to 7 days post your menstrual cycle before examining your breast. And we'll explore a little more as to why you would want to do that. And pretty much that has to do with the influence of hormones on your breast during your menstrual cycle. So estrogen usually, of course, is surging during the first half of your menstrual cycle. And what estrogen does, it stimulates growth of the milk ducts in the breast. And then generally in the latter half or second part of your cycle, progesterone takes over, and that stimulates the formation of milk glands. So all that fancy wording to say that these changes produce some changes with the breast, whether there be soreness, pain, or swelling in the breast. And so if you examine your breast right before your cycle starts, that will then throw off maybe what you're feeling, because that just may be what we call fibrocystic tissue or lumpy tissue that you're feeling because of the influence of the hormones. So that's why we encourage you to wait at least 5 to 7 days after the menstrual cycle is complete until you would examine your breast. So now here's this picture here of your of just the anatomy of the breast. And we'll kind of talk about this, and I may go back to this picture as we move through, but pretty much what I wanted you guys to see. As clinicians, we appreciate the breast as like a clock. You may have heard that when you examine your breast. So, you know, you have what you call your upper outer quarter, lower quarter of the breast, the upper inner quarter, and the lower outer quarter. But generally, when we record, if we feel something, we record it as if a clock. So if it's 12 o'clock, 3 o'clock, 6 o'clock, or 9 o'clock. So that you may hear terms like that used, you know, if you go to your clinician. Also, too, here you'll see and kind of point out the breast is made up of fatty tissue as well as glandular tissue and fibrous tissue. So that's what gives us the feel, and why you may feel different parts may feel different as you get to, you know, near the skin versus, you know, when you go more to the chest wall or the muscle. That's why things feel differently. And you'll also see here some lymph nodes that we have. And so you'll see the collarbone here, and you have some lymph nodes that go above and below the collarbone, and then you have lymph nodes under the arm, and they all kind of drain the chest wall and things of that sort. So you may notice or hear people that talk about if someone has something that's cancerous, they may have palpable lymph nodes, and that's from the influence of lymph nodes that are draining the breast. So what are some techniques that we use to perform self-breast exams? The main one, or what I would say would be ground zero that you perform, is called inspection. And basically what you're looking at with an inspection, you're just trying to see, do you see any changes or asymmetric findings with the breast? And contrary to popular belief, you may have one breast that's larger than the other. That's normal. But I'm talking about maybe slightly larger than the other. Not one breast is a size A cup and the other one is a size C cup. That's a variance, a big difference. But you may have some, some people have normal breasts that maybe one is slightly larger than the other. Also, things that you're looking at that may be asymmetrically different, you're looking at skin changes. Maybe on one breast, the skin is smooth, you don't have any rashes or anything of that sort. And maybe you see on the other one, you do have a rash that maybe you've never seen before. Also looking at the nipples. Nipple changes, they can be whether we call, I don't know if you've ever heard of an inverted nipple or nipple retraction. So some people can have what's called nipple inversion, and that could be a variation of normalcy for them. But generally with nipple inversion, if you're able to pull the breast or able to extract the nipple and make it come back out, that's normal. But if the nipple is inverted and you can't, for some reason, pull it out or make it come out, that could be some cause of concern. That could be a mass that's behind the nipple that's making it pull in, and that's why you can't extract it back out. So those are things that you're looking at. You'll also be looking for nipple drainage. The only people that should really have nipple drainage, unless you're breastfeeding. But everybody else, nipple drainage, if you have not seen that before, that could also be a sign of abnormalcy. And then of course, you'll want to look at what does the drainage look like? Does it come on its own? Or do you have to squeeze the breast to make it come out? Those are things that you want to look at. And I've already talked about the size of the breast. Skin dimpling or retraction of the breast. So basically that happens when you're looking at the skin. Usually your skin is pretty smooth, but if you see that for some reason it looks like it's pulling in or sucking in, that could be some changes that may be alerting you that a mass could be somewhere in the breast that's making the skin retract. So those are things that you want to look at. Those are just some examples. So what I would say is before you examine your breast, we already make sure that you're 5 to 7 days after you have a menstrual cycle, if you're premenopausal, or you can just pick a day. You want to get in front of a mirror and look at your breast in the mirror during the inspection phase. You want to see, do you notice any skin changes? Do you notice any changes with the nipples? Are you seeing any issues as far as nipple retraction? Are there any skin dimpling or anything of the sort that looks out of the ordinary? Generally, what I would say when you stand in front of the mirror, the first thing that you want to do is have both of your arms down by your sides. And that's just kind of, at that point, you're looking to make sure that, there's no retraction of the breast, anything that looks different. Also, you can raise both hands above your head. And by doing that, if there is some mass that's pulled in when you raise your arm, above your head, that would allow for you to see that area better, because as you raise the hands, the area will then go in, like it's almost like it suctions in. So you'll be able to see retraction better when you do that. And you can also see retraction if you just kind of, sit there, or you're looking in the mirror and you put both hands along the hips, kind of pushing it in to see, do you see any retraction, any changes with the nipple? Also, what I did mention here, when I say nipple changes, also too, you want to just look at the skin along the nipple. There is, some people can have eczema, that's normal, but sometimes when you have like a, what do I want to say? It almost looks like a consistency of skin, like a rash. It looks like, it just looks kind of funny, like you haven't seen a rash like that before. That could be an indication of something that's called Paget's disease. So any changes that you haven't noticed before with your nipple, definitely you want to see your provider. And these are just some pictures that I found that I just wanted to show you as far as changes with the skin. Here, where you see my pointer, you'll see this is what's called, the term is called peau d'orange. And if you can imagine closing your eyes, thinking about an orange, you know how the skin of the orange is rough And you can kind of almost see like the little dots here that are like on the orange. That's why we call it peau d'orange. But this is something that's concerning because this could be, and what we look at it is thickening and swelling of the breast. So that's what peau d'orange looks like. Your breast should not normally look like this. And you can also see here that the nipple is kind of invert or is kind of slowly retracting. Generally, most people have nipples that are out, but you can see with the swelling of the skin, the nipple is now starting to go in and slightly retract. So that's nipple retraction, and the skin changes or swelling of the skin or peau d'orange. Here on this side, you'll see a rash of the breast. So now this is a rash that generally sometimes can be seen with what we call inflammatory breast cancer. So, you know, if you notice, like I said, if you have any rash or something that you've never seen before, you know, the first time I saw that clinically, we had a lady I'll never forget, and it was very, very distinct. She thought that she had been bitten by an insect, but on further examination of the patient, I couldn't find, you know, like if you've bitten by an insect, you'll see like a source where the insect kind of bit you, but there was like no source of where the insect had gone there. So we did a mammogram and ultrasound, and there was a mass that it was more so that she had other things going on behind there. So just things that you want to look out for when you're looking at the skin. And we just said a little bit earlier, we were talking about nipple drainage. This is something that you also want to look for when you're inspecting. And I tell people this, you know, we have some patients that go around, you know, squeezing their breasts, their nipples really hard to see if there's any drainage. You don't have to do all that. All you need to do is just look at the nipple, see if there's any skin changes along the outside of the nipple itself, and you just, you know, slightly express the breast. If there's some drainage there, it will come out. You don't have to go, you know, and try to kill yourself to try to squeeze your nipple. If it's there, it will come out. And generally, too, what people will notice, and I didn't put here, is generally they'll notice the drainage like on the inside of their gown or on the inside of their bra. What usually they'll present to the clinic and they'll say, you know, I've been feeling this wet substance on the inside of my bra, you know, and they didn't know what it was, but really what it is they're having drainage from the bra. They're not eliciting, it's just coming out on its own. So that's something for concern if you have that. And like I said, things to note, you want to know the color of the drainage, you know, does it have a milky consistency? Is it clear? Is it bloody? Is it green? Is it yellow? I've seen all kinds of colors, but the ones that are generally the most concerning is if it's bloody nipple discharge or if it's clear nipple discharge. But I would just, you know, say if you have any drainage and you've never had it before, please still report that to your healthcare provider. And after you inspect the breast, when you're, you know, just looking in the mirror and looking and make sure everything's okay, then you want to start the palpation portion of the exam. And what you're doing with this portion, you're trying to observe for any palpable masses, breast thickening, pain, or tenderness of the breast. One thing that I'm not sure if most people know, but I just want to make sure, I know in clinical breast exam, you're examined both sitting and lying back, and that should also be the same for self-breast exams. So I just wanted to make sure that I pointed that out. And that's because things may not be prominent laying, you know, sitting up as they are if you lay back. So that's why you want to examine in both positions. And exactly what I said here, I know it sounds pretty self-explanatory, but some people don't know that either. When you're examining your breast, when you're laying back, you should place that arm of the same breast that you're examining behind your head. So say, for instance, if you examine the left breast, the left arm should be behind your head, and then you examine with your right hand. Another thing that I didn't put here that may be helpful is before you examine your breast, you can use a pillow if you want to put it under your left shoulder to kind of just help you not lay so flat when you're doing your self-breast exams. And another thing that I didn't note, another great place that some people do breast exams are in the shower. Sometimes the warm water and the soap allows your hands to just kind of glide across when you examine the breast. So that can also be a place. If you don't necessarily, examine your breast just sitting up on the outside, you can also examine, that would be your sitting up or standing up position in the shower. So that's another common place that you can. So now here are some key things that I always like to tell people. When you're examining your breast, it is best to use the finger pads of your 3 middle fingers instead of the fingertips. And why is that? When you use the finger pads, it allows you to compress the breast tissue between the fingertips. So you get more of a grip and a feel. When you're doing just with your fingertips, you're not really feeling that well or really examining the breast that well. So that's why we say use the finger pads. Also, too, there are varying types of pressure that you can use when you're examining the breast. When you are examining the tissue that's closest to the skin, you can use light pressure. And then when you go fully out more so into the breast, you maybe want to just apply just a little bit more pressure, medium pressure. And then, of course, as you get closer to the chest wall and to the rib area, then you may want to use deeper pressure. But still not at a point where you're just, trying to knock yourself out, examine your breast. Some pressure, but not enough to just, knock yourself out, just some pressure. So there are a few techniques that you'll find in regards to how you examine your breast. So the one that's the most common and that I like, and I feel that gets most of your breast tissue examined, is called the lawnmower pattern. And it's basically like if you could imagine you were outside mowing your lawn and you were going up and back. You would just kind of use your hands, the pads and fingers, and just go up and down and just go over. Once you go all the way down, go over slightly and then go back up. And that just allows you to examine the whole breast. So it's moving from up and down from one side of the breast to the other. That's the lawnmower pattern. Some people like more of the circular pattern. You start on the outside and you examine the breast starting from 12 o'clock, going around in a pattern, and you're just slowly inching your way from the outside of the breast more towards the inside of the breast toward the nipple. And then they have another pattern that's called the wedge pattern. And pretty much it's kind of almost like the circular, but it's just a wedge. You're moving from the outer edge of the breast and moving your fingers toward the nipples and back to the edge. And that's just making sure you're getting that whole area from outside to in and back and making sure you're not missing anything. Now, one thing is that we as practitioners do is we examine your lymph nodes. And sometimes it can be difficult to do as a practitioner. So it may even be difficult for you to do on yourself. And what you basically do is the lymph nodes that are most concerning and connected to the breast, of course, as I showed you on that picture earlier, were the supraclavicular and infraclavicular lymph nodes. So if you can just imagine your collarbone here, you would just go above the collarbone to examine, and it's just with your finger pads as well, light pressure, not, dimming yourself in. And basically a lymph node almost feels like a little bean. If you've ever felt like a little BB-sized bean or something, but it should be mobile. It should be, shouldn't be fixed or hard to your skin. And that's also something that you want to evaluate when you're checking your breast. If you think that you feel a mass or a lump, if it's, very soft and, kind of fluctuates or pliable with the skin, that's better than if it's something that feels hard and fixed to the skin. But either way, if it's a lump that you've never felt before, I still encourage you to see your practitioner. But that's something that we look for. Is it something that's soft and movable, or if it's something that's hard and fixed? Hard and fixed is bad. That's definitely something you want to have looked at immediately. But like I said, go to your collarbone and you want to examine just above Those are the supraclavicular lymph nodes, and the nodes that are below the collarbone are called the infraclavicular lymph nodes. And they drain, like I said, the chest wall. You know, you have your pectoralis muscles and all that. So that's why, if you notice, sometimes they may be inflamed or enlarged with breast cancer. It's due to that. So you may see the lymph nodes. Also, too, the armpits, or as we call them in the medical world, the axillary regional lymph nodes. You want to make sure that you feel under the armpits. One thing that I just noticed that I didn't put in the exam when I'm saying that the lawnmower pattern or even the circular, you want to make sure that you're going to the tail of the breast. So that means you have breast tissue that extends under your arm. A lot of people don't examine that area, but make sure that you get the breast tissue that's under, going toward the outer part of your arm. Believe it or not, that is where most breast cancers hide, is in the tail of the breast. So please, on both sides, when you examine all the part that you can see, but also extend under the arm, which is called the tail of the breast. Sorry. So in closing, what I hope that you got from this, I know it was a lot. I want you to become very familiar with your girls or your breast. You would not imagine how many times as a clinician I'll ask patients, okay, is this something new? Have you felt this before? And they tell me, well, I don't examine my breast. And I'm like, why not? And they're like, well, I just think that's, one lady told me she thought it was freaky. I don't know. But I'm like, they're your breasts. So if you don't know what they feel like, who else is going to know? And sometimes we would have a lot of patients' partners that would actually find, their breast lumps or abnormalities. So if you do have a partner and they're examining your breast, kudos to you. At least somebody needs to be examining your breast once a month. As I said, know the signs and symptoms that are concerning and report them to your healthcare provider. Again, we'll repeat, that will be nipple inversion, nipple retraction, nipple drainage, skin thickening, skin retraction. Also, maybe a major difference in asymmetry of the breast, any rashes that are concerning, and also too, just that skin changes that we showed earlier, the peau d'orange. If you don't remember anything else, you remember the peel of the breast, how it's hard and how that material is. That will make you remember that orange thick peeling, and that's basically when there's swelling of the breast. And breast self-exams are wonderful, but they're only the first step. So what I would implore you guys all to do, and make sure, I know COVID messed a lot of people up and threw people off, is to make sure that you keep your yearly appointments, whether it be for your clinical breast exams with your physicians, but please make sure that you have your mammograms. And some people, if they're at high risk, they may have to do MRIs. And so when I say high risk, I mean people who are, maybe have first degree relatives with breast cancer, and first degree relatives are generally, if you have a mother, a sister, a daughter, a father, or a son, and especially if you have a male in your family that has breast cancer, you're at even higher risk of developing breast cancer. You may even have a genetic predisposition. So know your risk. Please know your risk. And I always say this, ignoring the signs and symptoms will not make them go away. So burying your head in the sand, I know it sounds great, and you say, I don't really want to deal with this right now, but really the action should be to deal with that now, because if you do have breast cancer, God forbid, you would want to catch it in the early stages if you can.
Awesome.
And that's what I'm just telling you. And any questions? Yep, you got it, Tia. So that's my whole spiel, but I'm here to accept any questions.
So thank you. We have a lot of questions. And first, I want to just say thank you so much. This topic, like I was saying earlier, it's near and dear to me, not only because it's Breast Health Awareness Month and, or Breast Cancer and Take Action Month, but so many people are going out to get screened. This is a time of year where the town is painted pink. And, I was diagnosed with breast cancer at a young age. And for me, doing a self-breast exam is how I discovered it. And so looking at those statistics, 80% of women who have been diagnosed with breast cancer under the age of 40 found the lump themselves. So this topic is so critical, is so important. And I just want to say from me to you, thank you so much for shining the light on this topic tonight. And so, thank you. So since we're talking about early detection, we know that early detection for breast cancer is really key for us to be able to have, better outcomes. So outside of us actually performing a self-breast exam, a routine self-breast exam, let me clarify that, what are some other ways that we can be proactive in checking our breast?
Well, I mean, yeah, like you said, besides doing your routine monthly exams, also listen to your body. I mean, you don't have to listen to the signs and symptoms of breast pain or tenderness. Now, what I used to always get is, and it varies. I hear it all that, breast cancer doesn't hurt, or, all these different things. And that is, it just varies from person to person. You could have a breast cyst. Sometimes they can be painful. You could be someone that has fibrocystic breast disease. You drink a lot of caffeine. That could be what's causing you pain or tenderness. It could be a whole plethora of things, but not only just examining your breast, listening to your body, getting in tune for what's normal for you, whether it is, like I said, pain, tenderness, and also too, like I said, like with ladies I knew that they were, sleeping and then they wake up and something wet is on their gown and they're thinking, oh, I was just having hot flashes. But I'm like, you just had the spot on your gown. That didn't make any sense. But, we'll try to explain things away. And I want people to stop doing that. Stop explaining things away and look at it straight ahead and say, this is crazy. Now, even if I am sweating, my whole gown would be soaked. It wouldn't just be right here. That doesn't make any sense. So I have to tell people, use your common sense. That's what you have it for. And I think a lot of people, they downplay it and they want to explain it away. But my thing is, just be proactive about that. And like I said, also too, getting your exams. A lot of people don't even realize that, okay, screening now it's 40, it's gone to 45. They've gone back and forth. I can't keep up. But like if you have a family member, a first degree relative, like I was saying, that say for instance was diagnosed early, you may be able to, get your screening mammogram early. You may not wait to 40. So that's one thing too. So that's when I say about knowing your risk, knowing your family history. I don't know if y'all family is like a lot of families, the older generation, they don't like to tell their business, is what my granny used to say. But knowing that family history helps a lot because, a lot of family members take secrets to the grave and it does not benefit the next generation. It just makes things worse because, you'll be walking around here and not even know that somebody has a genetic, predisposition and you don't know it. It's like, oh, well, I didn't know that that's what Uncle Henry had, especially with men. I think men are very ashamed. Especially, I noticed when I took care of men, we would have one man, he would hate to come in the waiting room and wait. So I just told the nurses, I said, look, when it's time for y'all to call him back for me, call him and he'll come out of his car and come in. So it's a lot of stereotypes, shame. I don't know how to break those stigmas, but all I can say and promote is people, we got to wake up. Because some of these things are preventable, some things are not. But if it's something that we can do, we need to try to do something about it.
Yeah, absolutely. Having the conversations in our family is so critical and so important about our overall health. What's going on with our family members. I mean, that is critical. And not only having the conversations about our family health history, we also just need to know about our bodies. You know, I think about when I was young, I had an auntie that was diagnosed with breast cancer. She wasn't a blood relative. And I was in the 7th grade. And of course, you know, back in those days, we didn't have the internet. We had those big old thick books, encyclopedia books, you know, and all I knew was Aunt Linda lost her breast, but we never, ever talked about it. Like, you did not bring it up. You didn't talk about it. So can you imagine what my 12-year-old mom was thinking about losing breast? So, you know, I was blessed enough to learn about self-breast exams during that time through my sex education class. But there's so many parts of our body that we don't learn about, we don't talk about, we don't pay attention to, we're not exposed to other bodies, so we don't know what's normal and what's not. And so, you know, you brought up a good point about, you know, if something doesn't seem right, you know, you think you're just sweating or what have you, go get it checked. I have so many women that I've supported that will tell me, you know, my breast was leaking, or I felt this, but, you know, I just thought it was, you know, whatever, right? But it's not normal. These things are not normal that happens. And so we should never be, and I don't think it's always a fear thing. I think it's just, we just blow it off because it's not this big wow factor, right? Even with breast cancer, I mean, it doesn't always create pain. I just felt the lump in my breast and was like, wait a minute, what is this here, right?
And that's true with the pain, because that was always the number one question I would get. Well, shouldn't it hurt? And I'm like, well, it may not hurt. You know, everybody does not have the same journey. Absolutely. So what you had, I may not have. Yeah. So that's one thing that I also like. And please too, I want to say, don't be Dr. Google. You know, it's great to Google things, but Google with discernment and get some expert help.
Yeah.
Because
sorry.
No, go ahead.
No, I was going to say, and speaking of expert help, you know, I think about insurance, right? And we have some women that will say either they don't have insurance and so they don't go, or they have insurance, but they can't afford the copay. And we call that underinsured. You know, there are programs that are out here for individuals that will cover the cost of a screening mammogram. At least get a screening mammogram, if nothing else. You know, a screening mammogram may lead to a diagnostic. And in the hospitals, they have, you know, some of the hospitals do have like the indigent care. They do have the grant programs or financial assistance programs. So don't let that, anybody who's watching this, don't let that be a deterrent from you going to get checked. Because again, early detection can save your life. Right.
Yeah. And you're right. I noticed when I worked, you know, there are different, I know here in Georgia, some of the health departments, they have programs, of course, they're federally funded, but, you know, you have to check your local health departments where they can send you somewhere. We would give patients that, say, for instance, they would come from, you know, the health department. They may have already had their mammogram, or maybe they didn't. They would just had a symptom. And they sent them over to the breast specialty office, and we would do either their mammogram and their ultrasound and work them up from there. Then if they needed, say, for instance, say if God forbid it was cancer or they needed anything, then of course, if they were, like you said, underinsured, sometimes they could get, you know, Medicaid for cancer. It just all depends, like you said. And then like different hospitals they have for indigent care. So I agree. Don't let that be the barrier that you don't get any help, because there are a lot of programs out there.
Yeah. So I want to get more into the self-breast exam, because that's what tonight's topic is just completely all about. And I know we don't talk enough about it, especially when you look out there, you know, some of the larger organizations have said, you know, they're not really seeing a big difference, right? They're not really pushing self-breast examinations, but self-breast examinations are critical. And even between mammograms, we should be doing self-breast exams. I hear time and time again, women will say, well, I got a mammogram and I'll just, you know, check next year. And I'm like, no, well, what happens in between? And when they get, you know, sadly, if they do get diagnosed with breast cancer, they're completely heartbroken because they said, I just had a mammogram. And I always tell them, unfortunately, that can happen. We know a mammogram, nothing is 100%, right? But
Right.
it's the best thing that we have that's out now. Last month, we celebrated World Dense Breast Day, and we also, with Salon Conversations, we had a talk about dense breast tissue. So again, for those who are tuned in, be sure to go back and look at our last Salon Conversation on dense breast. But that's something that's important. If we do have dense breast tissue, depending on our levels, we may need to get additional screening or additional imaging. So these things are really important, but I want to get back to that self-breast exam. So when we're actually performing this self-breast exam, how do we know if we're applying enough pressure to really feel? Because we know that some tumors, can be deep in the chest wall. So how do we know if we're actually applying enough pressure?
Yeah, and that's why I was saying in the presentation when we were talking about the deep levels. Now, some masses, unfortunately, you just may not be able to feel if they're that local to the chest wall or to the ribs or clavicle. You may not feel those. But those that are generally, like I said, if you use the finger pads, that helps. When you want to give some pressure, but just not enough, so you're feeling. Because some people, I'll watch my patients when I'm shadowing to them how to do the exam. So that's one thing. Hopefully, and I hope after tonight, maybe when you go back and you see your provider, they'll, because I can't see you or visually check you off. I look to see what they're doing, and some of them they're just kind of ever so lightly pressing, and I think they think they're going to hurt themselves. And I say, well, no, you want to go a little bit harder just so you feel the tissue, not so hard that, like I said, you have to puncture a lung underneath, but just enough pressure just to feel. So, it may be just that medium pressure that you need. But even too, what I always look at when I'm doing a breast exam, when I'm asking you before I even start the exam, and I'm saying, hey, Mrs. Jones, are you having any breast pain or tenderness? And they tell me no. But then when I'm examining you and I'm applying pressure and you're making faces, obviously something's going on. And I'm generally not applying that much pressure that I'm, making the patient come out of their seat. So also when you're doing it, you may not have thought that you had any breast pain or tenderness, but as you're feeling, you may start saying, wait a minute now. I'm feeling some pain or tenderness. What is going on? And if you know that you're not trying to knock yourself out with pressure, why are you feeling the pain or tenderness? Do you have, I don't even know, probably most providers tell you that. I don't know about family practice providers, but I know if you go to a breast specialist, we discuss more about fibrocystic breast disease and caffeine intake. So as a patient, you have to also know, did you, or are you one that consumes a lot of caffeine? And you have to be honest with yourself. So if you drink 3 cups of coffee, and I'll ask patients, how many cups of coffee do you drink a day? And they'll tell me 2. But then I explore a little bit more. Well, how big is the cup? And then they tell me, 32 ounces. I'm like, well, that's 4 cups right there in the one. So I always say, when you're taking all this into account, what are you doing that's contributing maybe to breast pain or tenderness? Are you drinking, sodas? Are you drinking energy drinks? People don't even think about those. Energy drinks have caffeine. Chocolate has caffeine. All these things that you're consuming that probably most people don't think about. Even one, I'm going to blow your mind, cigarette smoking causes breast tenderness. So if you are a smoker, you could have breast tenderness. Why does that influence the nicotine, influence the breast tissue? I don't know. But that is something that also can be causing breast tenderness. Not only causing breast tenderness, but also could cause a secondary cancer, lung cancer. But that's neither here nor there why you shouldn't be smoking. But all kind of things that, maybe you didn't know about. Oh gosh, I drink a lot of caffeine. Probably I should slow down. Oh, I'm smoking. Oh, I didn't think about that. Oh, I'm drinking all these energy drinks. I know at one time, I don't hear many people talking about them that much, but I know a lot of people were drinking a ton of energy drinks, when I was kind of back in the heyday.
Yeah.
And we don't know what all these other things do, like vaping and all that, who knows? Because, it doesn't have the other effects, but vaping has still other things in it. So it's a lot of things that we don't know and we haven't uncovered yet to know what they can cause. Also, too, are you taking hormonal therapy? That's something to think about. Are you postmenopausal and you're taking hormones for your hot flashes and things of that sort? So those are all things to consider.
Yeah. And that's so important. And it's funny you mentioned that, because I remember when I was doing a medical program after I completed undergrad. And of course I was stressed, right? I was studying and trying to stay up all night. And I would go to 7-Eleven and I would get these big cups of coffee and I would eat Twizzlers and I would chug them down just to stay up so I could study. And I started to experience the breast tenderness to the point I couldn't even wear a bra. And my doctor asked me that question and I said, yeah. And he said, that's what it is. Stop. And as soon as I stopped, it eventually went away. So, thank you for bringing that up. And someone did ask a question around the pain and tenderness, does it actually typically reside or does it continue and does it progress, when it comes to breast cancer or any other breast condition, not just breast cancer?
Yeah. So now, that depends. Like if the tumor or mass is getting bigger, then yes, it may increase versus the same thing, like I said, with the cyst. So I don't know. I mentioned that off the fly, but I don't know what you mean. So a breast cyst, that's a benign. They can't usually, they're benign and they're usually fluid-filled cysts that are in the breast that can cause pain and tenderness. And they can fluctuate with your menstrual cycle as well. But they can also get bigger and cause more pain and tenderness. So it just kind of fluctuates. And like I said, everyone that has breast cancer, they don't always have pain. So that varies also from person to person.
Right.
So the person with breast cancer may not even have pain.
Yeah. And I want to jump back to when we talked about the depth. One thing that I tell ladies, especially if they're top heavy, to help them get closer to the chest wall is to, let your breast hang. So bend over and let them hang to get your hand up behind that breast wall to get closer. Get behind the breast to get closer to that chest wall to be able to feel, because when we're top heavy and we're just doing this on top.
Yeah, you're right. That is definitely that's a battle for top heavy people, even with mammograms. They have to have more views and pictures because they are so top heavy. But yes, you are definitely correct. When you're top heavy, you have to. And what I do, I know as a provider, I use, you all can't do that because you're examining yourself. But when I examine, I use both hands. But see, because you can't do that because one hand is behind your head. But definitely, I would say to lean forward. And like I said, use that shower. Things feel so differently when you're that warm shower. You have soap, you have body, gel or whatever gliding over your hands. Use that as your guide. I think things feel definitely different when you do that.
Yeah. And I'm gonna give a little plug. My mother was not doing her breast exams. And so I developed a breast massage oil to get my mom to check her breasts. And now, women are purchasing it. But I did that, not so much it was about selling it, but it was about, hey, if this can help you check your breast, by all means, I'm gonna do it. And so, you talk about being in the shower and the lotions and things like that. It does feel completely different. And you're being more intentional in when you're actually utilizing those things. So we've talked about women with breast tissue. What about women who do not have breast tissue? Some of our women either had a mastectomy or they're flat, had a mastectomy and now have implants, and some had a mastectomy and are now flat. So should they continue to check their chest or their implants?
The answer is yes. Definitely easier to do if you had a mastectomy with no reconstruction. There is a chance that you can have a recurrence along the chest wall. It's very small. But when they remove the breast, they try to remove as much breast tissue as possible. There could be, as you know, of course, they leave a small rim because that's what gives life to the that area. So you can't remove all the tissue. So yes, I would say continue to do your monthly breast exams, even with an implant versus flat. Now, of course, your breast tissue is gonna feel, and it also depends too. You got to think about it. If you had a mastectomy and you had to have radiation, your skin is gonna feel different. From the radiation, skin changes, so it may feel more so like that thickening area that you feel because the skin is thicker when you have radiation changes, and also too with the implant itself versus if you have a saline versus if you have a flap, because if you use your own body tissue, it may feel different because believe it or not, and I don't know if anyone has had reconstruction, you can get what's called fat necrosis. Mm-hmm. And that can feel like a mass or anything, but still, that's something that you need to report to your reconstructive surgeon because it may not be fat necrosis. It could be a cancer that's coming back and recurring. So yes, you should still do monthly breast exams.
And speaking of that, we've talked about women, and the same thing that we're talking about women and checking their breast and or chest, men should be doing the same exact thing, right? Men should be checking theirs, and women, we should be intentional, not only checking ours, but even our partners. Just like men, they check ours, right? Mm-hmm. In more ways than one. And I think it's important for them to know how to check our breasts and to be intentional, especially in those intimate moments, because oftentimes when women are not touching themselves and feeling themselves, the man will actually find it. So I want to ask you one last question. You talked about the lymphatic system. Mm-hmm. What does the lymphatic system have to do with our breast health? And I know we're running short on our time, so I want to get this question in because I think this is a very important question because we don't talk enough about the lymphatic system.
So the lymphatic system in general is responsible for clearing out infection and things of that sort. So it helps kind of rid your body of infection and fight those kind of things. So when you have cancer, of course, your body is not able to fight like it has. So that's why the lymphatic system is not, able to do that. So in turn, you may develop like lymphadenopathy or lymph nodes that you feel. So you actually will find that with any cancer, whether it be breast, whether it be, colon, you could have lymph nodes that are palpable elsewhere. But generally, like I said, with cancer, you think of fighting infection, things of that sort. And so with cancer, that's why you have lymphadenopathy.
Yeah. Well, listen, this was a great conversation. We could go on and on and on talking about this. I think it's very important for us to, spread the word about doing your self-breast exams. We have a Breast Health Matters program at My Style Matters where we're teaching young girls and women about breast health. And it's called Breast Health Matters. We do Hey Girl, Hey parties, where we will actually go to your home and, throw a party, a sisterhood party for you and your girls to really focus on how to do self-breast exams, how to care for our breast health and our overall health as women. So again, for those who are tuned in, spread this message. It is so important. We've got to stop the silence in our homes, in our communities, so that the next generation can live and live vibrantly, live healthy. We don't want them to hear those words as cancer. So again, I just want to say thank you so much, Rhonwynn, for being with us tonight. I really, really appreciate this very important conversation. And I want to thank everyone for joining today's Salon Conversations. We hope that you enjoyed this session as much as I did, and that the information that we shared today will help you in your health journey.